Do you often feel like people are talking about you behind your back, even when there's no proof? Or maybe you've avoided sharing personal details with close friends because you're afraid they'll use them against you later. If this sounds familiar, you might be experiencing thoughts linked to paranoid personality disorder (PPD). PPD is a mental health condition in Cluster A, which includes disorders that cause odd or eccentric thinking. People with PPD aren't just cautious, they deeply mistrust others, even when there's no real reason to. For example, imagine your coworker smiles at you, but you're convinced it's a fake smile meant to mock you. You might avoid them, argue, or even report them for being unprofessional. This ongoing suspicion can make normal relationships really hard. But remember, having a suspicious thought once in a while is normal. It's when it happens all the time and causes problems that it could be PPD. So why does someone develop PPD? Experts believe it's a mix of genes, brain chemistry, and life experiences. Think of it like a plant. Genes are the seed, your brain is the soil, and life events are the weather. If your parents or relatives have had similar thinking patterns, you might have inherited a tendency towards suspicion. For example, if your dad always said, "Don't trust anyone," you might grow up believing that too. Also, tough childhood experiences, like being lied to, abused, or bullied, can make you hyper alert to danger. Say a child's caregiver often lied or played tricks on them. That child might grow up feeling like everyone is untrustworthy. It's not one single cause, but a combination that builds this deep wariness over time. Let's play a quick game. Picture this. Your partner is 10 minutes late coming home. What's your first thought? A, traffic must be bad. B, maybe something happened. C, they're probably cheating or hiding something. If you pick C often and believe it strongly, that might be a sign of PPD. People with PPD usually show symptoms like constant doubt about others' loyalty, reading hidden meanings into harmless comments, holding grudges easily, and feeling attacked even when not. For instance, if a friend says, "You seem quiet today," a person with PPD might hear it as, "You're weird and I don't like you." They may also get angry quickly, refuse to forgive, and struggle to work in teams. These aren't just personality quirks. They cause real issues in jobs and relationships. PPD isn't diagnosed with a blood test or brain scan. Instead, mental health doctors talk with you using special questions to understand your thoughts and feelings. They don't label someone too fast. Everyone feels paranoid sometimes. But if you felt suspicious and distrustful for years, not just during a stressful time, and it's hurting your life, they might consider PPD. Treatment is tricky because many with PPD don't think they need help. They believe the problem is everyone else. But therapy, especially talk therapy, can help. It's like having a safe space to practice trust. A therapist might say, "Let's explore what makes you think your coworker is plotting against you. What facts support that?" Over time, this helps you test your thoughts. Medication isn't used directly for PPD, but if you also feel very anxious or angry, doctors might prescribe something to help calm your mind. Progress is slow, but possible. Can we prevent PPD? Not fully, but we can reduce the chances, especially in kids. Think of it like wearing a seatbelt. You can't stop all accidents, but you lower the risk. A safe, loving childhood helps a child feel secure and trust others. For example, if a child shares a secret and the parent respects it, the child learns that trust can be safe. Open communication, emotional support, and positive role models matter. For teens or adults who already feel overly suspicious, early counseling can help. It's like fixing a small leak before it floods the house. Learning skills like managing stress, expressing feelings calmly, and questioning negative thoughts can make a big difference before paranoia grows too strong. Recent research is starting to use brain scans to see how people with PPD think differently. Studies show that areas of the brain linked to threat detection, like the amygdala, may be overactive. It's like having a car alarm that goes off even when someone just walks past. One 2023 study found that cognitive training, exercises that help people question distrustful thoughts, reduced paranoia in some with PPD. Another project is testing if online therapy tools can help people practice trust safely from home. While there's no cure, science is slowly finding better ways to help people feel less on guard and more in control